Hey everyone, it's Dr. Erica Patterson, physical therapist. Welcome back to my channel. This is the first video in our series about the top 5 things PT school doesn't teach you about working in a skilled nursing facility. Topic number 1, what is a skilled nursing facility and what does your typical day look like as a PT? If you look at the continuum of care, we have hospital care on one side and outpatient care on the other. Skilled nursing facility is right between those two. If someone goes to the hospital but they aren't quite ready to go back to where they were living before the hospital, instead, they'll get referred to a skilled nursing facility for a short bout of rehab to get them to the point where they can go back home. Now, sometimes patients will go to an assisted living facility, an independent living facility, a group home, a CBRF, which is a community-based rehab facility, or sometimes they'll be discharged to long-term care, which means they remain at a facility to continue receiving care, or sometimes they're discharged to hospice. Those are the most common discharge locations. The typical patient demographic you'll see at a skilled nursing facility is around 50 to 60 years old and older. They might be that short-term care patient or a long-term care patient. They are usually more stable than they were at the hospital, but they can have pretty complex past medical histories. As an evaluating PT, you have to place them into one of the PDPM clinical categories, which summarizes the main reason they're being treated at that skilled nursing facility. Those categories include cardiovascular and coagulations, pulmonary, acute neurologic, acute infection, cancer, orthopedic surgery, non-orthopedic surgery, non-surgical orthopedic, medical management, and then major joint replacement or spine surgery. Medical management is more of a catch-all category for other diagnoses like patients who have had a failure to thrive, repeated falls with no major injuries, or another type of chronic diagnosis. Now, your typical daily schedule as a PT, you get a list of your patient names, the room that they're in, how much time is allotted for each patient, any of the treatment codes that you can bill for, precautions to be aware of, and then any upcoming notes that might be due. You can see your patients at any time throughout the day. It's up to you how you organize your schedule, as long as everybody gets seen. Now, occasionally you can have a missed visit or a refused visit in this setting, but it doesn't happen too often. And then when you're working through your day, you'll have to work around meal times, coordinate with the nursing staff to make sure that everybody's up and ready to go to get their therapy in each day. And that's your typical schedule. All right, guys, that's our topic number 1 in our series. Don't forget to like, comment, and subscribe. Hit the link below to join our Facebook community, the Skilled Nursing Facility PT Mentor, to continue learning how to level up your career as a physical therapist. As always, advocate for yourself and your patients. See you next time.